fire extinguishers. There's two different types of fire extinguishers that are in your area. Number one, okay, see there's a little bit of a difference between these fire extinguishers, okay? Can I actually unintentionally hurt somebody with a fire extinguisher? Absolutely, okay? So you have to know, again, you have to know the difference of the dry chemical versus the CO2. Now, the dry chemical is located all throughout the hospital, in the cabinets, in the hallways. It has a powder in it, chemical powder. Really not great for us to be breathing in. Absolutely not great for your patient or any piece of equipment that you may have within an OR setting. Okay, so please don't ever run out into the hallway and come back with one of these into an OR. Okay, you should have CO2, and you happen to maybe like notice a difference. We've got the rubber hose versus the plastic cone on this fire extinguisher. Okay, now you can, right, utilize a fire extinguisher in this environment within an OR. You can utilize the CO2 on an actual patient. Okay, it's okay to do that. I always like to say, as a last resort, you have a ton of other options. You have your water, you have blankets, you have towels, you have a number of things that you can put out that fire with. But as, you know, as a last resort, we may have to utilize the fire extinguisher. And so what I like to say, before we talk about PASS, I'm sure you've all heard of PASS before, but there are some rules with this thing. And I don't know if Colin, he was here last time, or any of our other consultants ever explained this to you. This is how I think of it, okay? You should really keep your back to the door, okay? That way, if something bad happens in the room, right, fire gets worse, what do I do with this thing? I don't care what you do with it. You can drop it, you can punt it in the room like a football. I don't care. Get out, okay? Get out with your patient, take your patient to a safe place, okay? 6 to 8 feet away, that's how far these things will spray. And then the last thing is, I don't know if we've ever explained this to you, but these things are rated for different types of fires. So the CO2, which is a compressed gas, it's meant to cool the fire. So when it comes out, right, it kind of looks like snow. Okay, and this is what kind of allows us to spray it at somebody. So it's only rated for class B and C fires. So really, what does that mean to you? Chloroprep if it's on fire, so any bubbles or boils, or any circuit current. So if there's a piece of equipment that's on fire, we may be able to utilize that. Hospital-wide, ABC, general purpose. So if you're in the hallway and there's a piece of equipment that's on fire, or you're at the nurse's desk and something is on fire, you can certainly utilize this dry chem or the dry powder extinguisher. Now the difference with this, right, snow, when it comes out, powder. Okay, so again, we don't always, never recommend this within an OR setting. And then the last thing is, how do I know, other than the type of fire, how do I know whether or not I'm going to be successful? What if the flames are as large as the screen here, as tall as the ceiling? How successful am I going to be with this thing? Right? Never once did I ever get off the engine holding onto one of these to go in and put out a fire in a home. All right? So the flame should never be larger than the fire extinguisher that you're using. Okay? Whether you're here or even at home, okay? Because if it's bigger than this thing, odds are it's too big, okay? It's just too big. So I don't want anybody to get hurt. So now at this point, we'll talk quickly about PASS. You've all heard of it before. So if this is my OR table, let's get rid of this thing. My OR table, I've run through the whole process. I've tried water, I've tried my sheets or my blankets, and it still hasn't worked. So now I'm gonna grab the fire extinguisher. Now it's go time, right? If the patient's on the table and you're here, right, you're really not in a good place. So that's why I always like to say, keep your back to the door. That way, when I get ready to use this, because it's a compressed gas, it comes out with a little bit of force. So if you're standing there, you're liable to get a face full of whatever's in this, right? And that's not a good day for you. So when I'm ready, pull out the pin, right? That's step number one. I'm standing there with the pin in my hand. Do I need the pin anymore, right? Chuck the pin, you don't need it anymore. Just don't hit anybody in the face with it, okay? So now it's armed and ready to go. The unique thing about this is that, again, it's a compressed gas, so when it comes out, it's frozen. If you're holding on to the cone, right, rubber glove, cold, right, it may actually stick. So you don't have to hold on to the cone. With this one, right, if you're utilizing this one, it's got the rubber hose on it, you gotta hold on to the hose, all right, or else it goes everywhere. What I like to say is I hold on to the base of the extinguisher. Now when you're aiming, don't get caught up in the flames. That's just gas that's burning. You're gonna aim right down at the base of the fire, okay? Squeeze, sweep. Now it's not like sweep the whole room, it's right at the base of the fire. And if you put the fire out, congratulations, stop spraying, okay? You don't have to utilize, you'd be surprised, I've seen it, okay? You don't have to utilize this whole can on something that you already put the fire out. Okay, does that make sense? Okay, cool. Any questions on these things? Okay, awesome. We're almost done. Where's my clicker? Okay. Again, as a last resort, I like to, think about that. I guess we are done. So is there any questions about anything that I've covered so far today? Okay. So now, how many of you have seen the fire on a table before, like demonstration-wise? Some of you have seen that? So it's not this huge raging inferno. And so you think about, again, knowing what to do when there is an actual problem, okay, in this environment. So this is we'll pretend like this is our patient, okay? So we've got a small fire. Okay. Now, patient's on fire. Now, we've got to be quick about this. We cannot be lazy here, okay? Because if I walk over and I'm gingerly just doing this, what's happening to the fire? Okay, or I do this, right? What did I just add here? I added fuel, right? Because the sheets, they'll burn. Okay, the drapes, they'll burn. Your shirt will burn. Okay, so we've got to be quick. Now, with this, again, this is just a normal sheet. It'll put out the fire. I'm not going to have this huge raging inferno here. It will put out the fire. So head is here, okay? If I come over and I start patting, where does fire go? It goes everywhere, right? We need to control it. So head is here. Where do I push the flames? Feet, okay? I can't go this way with it. That's a bad day for them, okay? So when I come in, I need to be here, protect yourself. Okay, again, you always need to think about that. Some cases you just have to be a little bit selfish. I'm sorry to say that, but we have to protect ourselves too. So here, again, down, and I'm gonna sweep out that fire, okay? And then I need to verify, did the fire go out? Fire went out, great. Now we can take care of that. What I don't want you to do initially is pick up all of that stuff that's on fire, right? And chuck it. I gotta get it out of here. Not only did we just create a fireball, okay, but also somebody might get hit with it. And again, bad day for that individual. So is there any questions on that? Okay, so let's see here how we can manage this, utilizing real fire. And you'll see that, I'm not putting on any protective equipment or any of that stuff. It's just something very simple that we should be able to manage, all right? Okay, so again, very small fire. I'm coming in here, sweeping out the fire. Fire went out, okay? It's very, very simple, okay? But if we do it wrong, right, if we're too slow, again, I'm holding on to something that, it's actually on fire. It could actually start to burn, okay? So any questions with that? All right, so for those of you that have long hair, when you're over top of somebody like this, right, what may dangle down, okay? So if we're doing this today, most of the time you will wear, your hair is up. But like today, if your hair's not up, you may actually, we don't want you to have again, permanent reminder. So we don't want anybody to get burned. Okay, are we good with that?